So, Ward, on my floor, I'm known as Nurse Steve, and part of my job is to administer pain medications or analgesics. As a cancer patient for the past 3 years, what has been your experience with these powerful medications, and what would you tell someone in the early stages of a diagnosis of cancer?
Steve, I have mixed feelings about pain medications. On one hand, thank God. I mean, I think about people that don't have access, people in the third world that don't have access to those medications who are suffering from cancer. And what a horrific experience. I think about generations past where there was no medications and people suffered horrible tumors and things. So it's very hard to get down on pain medications because they're a miracle drug. On the other hand, my experience with pain medications really took me in a very unusual direction. And that is that, well, let me go back. Three and a half years ago, I was diagnosed with terminal colon cancer. It metastatic to the liver, so it had completely taken over the liver. And the doctor basically said, you have 3 months to live unless we do something. So if we are aggressive in our treatment, you might have 3 years. So I'm at 3.5 years now, so this is gravy. It's great. But here's the problem. I was given access to very powerful medications, opiates, Vicodin, fentanyl, which is a patch that you can wear 24 hours a day, Dilaudid, and morphine. You know, it's like you have a terminal disease, there's this assumption you're not going to come back, you're never going to get off those medications, and so, as you know, it's like we want to keep the patient comfortable. So, in the very beginning, I was given access to these medications. And here's where it gets odd. I had a lot of preconceived notions about what cancer was like. Painful, horrific. I had a lot of preconceived notions about what chemotherapy was. Painful, horrific. And so the general adage is stay ahead of the pain. So I took liberal amounts of Vicodin, and that helped. And then I had the fentanyl patch. Then the question arises, what was I feeling? I mean, that dulled my senses and numbed things. And I basically went to bed for a year. I expected to be ill. I was ill. And I was numb because of the pain medications. But every once in a while, the pain medications would start to ebb, and I would start to feel withdrawals. I now know, looking back, that some percentage of the symptoms I was feeling in that first year had nothing to do with cancer and nothing to do with chemo. They had to do with withdrawal, opiate withdrawal. I mean, think about that. That got all muddied up in my experience. So I have this assumption I'm going to be in pain. I have this assumption I'm going to be totally debilitated. I'm going to be in bed. I'm going to die. And so the only light in that room is pain medications. And it didn't take long before there was no nice feeling of floating or any of that. It was just baseline. And so when I was at my maximum, which was a 50 microgram patch from the fentanyl, which is 80 times stronger than morphine, by the way, and up to the maximum of Vicodin, which is 8 Vicodin a day, I could drive, I could function, I wasn't high, it was just what I needed to be normal. And when I started to come down, malaise, which is just this incredible fatigue, you just feel like an 80-year-old man. I had shakes, I had cold sweats, I would wake up in the middle of the night shaking. Well, guess what? Those are some of the same symptoms from the chemo. Those are some of the same symptoms from the pain. So what was I experiencing?
Right.
So that's why I say this is a two-edged sword for me. Now, there came a point where the tumors had reduced. The chemo had done its thing, and I actually got to be tumor-free. It's not the same thing as cancer-free. But there was no obvious reason to be on these meds. So I went to my oncologist and I said, how do I get off of these? I was expecting some protocol. And he said, well, just cut back. Well, that made sense for him, but this was not a spigot that you just turn on, off and on. I tried that. I went home and I really felt those withdrawals. And so while I wasn't psychologically addicted, my body was dependent. And fortunately, I met a PhD pharmacologist through my HMO, a young man, and he gave me some medication that I could use. He actually gave me liquid morphine. So I could use an eyedropper, so I could reduce the amount that I was taking on a daily basis by a very microscopic, virtually, level. He called it titration, where I just go down and down and down. It was still tough. It took 6 weeks of great discomfort to get off of these medications. And I'm happy to say that today, once in a while I take a Vicodin when I don't feel good or right after chemo, but generally I'm feeling good. And the question I have is how much of that year and a half I spent in bed could have been avoided had I been a little more judicious about the use of the medication that, I'll thank you again, nurse, thank you for helping me out of my pain. But how do we close the loop? How do we communicate? When's enough is enough? That was a tough lesson. That was a tough lesson, but one I hope I can pass on to other people.